Hello, hello. We are going to review your chapter 4 in your fundamentals textbook. It's on the nursing process, critical thinking and clinical judgment. The objectives of this is to explain the use of the nursing process. We want to look at all the components, understand what critical thinking, clinical reasoning, and clinical judgment, what those mean and the differences. Be able to understand the steps of the problem-solving process and the steps used in making decisions. Um, we will be able to identify different ways to improve your critical reasoning skills, being able to apply them to a real-life problem, and discuss the use in nursing. And of course, as y'all will start seeing patients, I'm not sure what term you'll be seeing patients, it'll probably be another term or two. That's when you're going to be able to put this in practice, where you're going to start putting these critical thinking skills in and use them to take care of a patient safely. That's always the most important thing, is safety. Always remember safety. We want to care for our patients in a safe manner. So the nursing process. So, first of all, why? Why? It seems like a lot of trouble, right? But it's basically just a systematic way of thinking and acting. It's a step-by-step process, and it's a process. It's a tool to help us determine what a patient's problems are, or even potential problems. It may not be a problem now, but it could be potentially a problem, right? For example, and this is something y'all will learn when you take pharmacology, but one of the diuretics that people get quite often is furosemide or Lasix. Some of y'all may have heard of that. Okay, that's great. It's a diuretic, helps pull fluid out, off of them. When you have a lot of fluid overload, your blood pressure is going to be high. So one of the things that you do to lower someone's blood pressure is to get them peeing. So they start peeing, they get rid of some of that fluid, the blood pressure is going to drop. Well, furosemide or Lasix is a really awesome medication that it's a diuretic. Diuretic, it means it makes them pee. Well, that's great, but it is also known for being what we call potassium wasting, meaning they're going to pee out a lot of potassium. So now, okay, we have a problem. We have this problem. This patient is hypertensive. Blood pressure is really high. Okay, great. Let's solve a problem. Let's give him some Lasix to make him pee, and we're going to reduce his blood pressure. But let's take one step further. Critical thinking means let's look at some potential problems. He might lose too much potassium. And your electrolytes are very important. They're very important the way your muscles perform. And what is a nice muscle that we have in our chest that's very, very important to all of us? If you said heart, you would be correct. So yeah, any kind of imbalance of potassium will affect the way your heart works and could potentially be life-threatening. So that's critical thinking, where you've got a problem, you're solving it, but then you're thinking, okay, wait a minute, let's take it one step further. What additional problem could this solve? The nursing process helps you put this all down, and it makes it easier for you to basically list it all out, right? Figure out how to change the screen here, sorry. So again, the nursing process goals: exploring their health status, identifying any potential problems that may come up, and determine what kind of outcomes you want. What do you want to happen? What is your end goal? Well, okay, with my hypertensive patient, my end goal is for him to have a normal blood pressure, and for basically his potassium to be stable as well, right? Um, so next step would be delivering the specific nursing interventions that will solve the problems and promote health. And then the last step is to evaluate. Did it work? Did what you did, the interventions that you performed, the tasks you performed, did it work? That's evaluation. It's no good doing something if you're not going to go back and check to see if you did it correctly, right? So here's the components: assessment, nursing diagnosis, planning, implementation, and evaluation. Now, you're all probably saying, well, why are we doing nursing diagnosis? Isn't that what the RN does? Yes, it is. However, you work with the RN. Often you collaborate together and you will come up with this nursing diagnosis together. You know, two heads are better than one, and you need to put your input in as well and help be part of the process. Then on top of that, you will be part of the planning and the implementation because you're going to be there helping care for the patient. So you need to understand what's going on with the patient. You need to understand what the nursing diagnosis is so that you can be part of the care team. Assessment, and I know we practiced this in lab this week, and that was awesome because I think that was amazing to put all this together. Assessment is basically just data collection. You're collecting data, and this can be done by interviewing the patient, asking questions. We ask a lot of questions, right? When was your last bowel movement? Was it soft? Was it hard? Was it loose? Was it fully formed? What color was it? Was it brown? Was it green? Yeah, some of you that are not used to healthcare go, whoa, that's TMI. Yeah, there's no such thing in nursing. So, and we ask for a reason because these things tell us, give us information. It gives us a lot of information. So we really and truly, we're not just asking to fill out a little questionnaire. We're asking because the answers actually mean something to us. They may not mean a whole lot to you now, but they will as you take more classes and get more training in different medical diseases and medical issues. So assessment, you're collecting data. You're going to interview your patient. You may interview family members. You may interview caregivers. You're doing this through asking questions. You're also using your eyes. You're watching. You're looking at their general appearance. You're looking to see if there's anything that's obvious to you. You're inspecting. Then you do your physical assessment. You're going to go through your head to toe exam, and all the head to toe exam is gathering data. You are just gathering data. So diagnostic tests, when we go and have imaging done or lab work done, that's gathering data, right? It's getting information. Now, next, you have your diagnosis. Once you gather all your data, you have everything in front of you. This is everything. We've got our questions, we've got our assessment, we have our imaging studies, we have our lab work. Now you put it all together and determine a nursing diagnosis. Now again, this is different than a medical diagnosis. The doctor has the medical diagnosis. You're going to have your nursing diagnosis. You all should have access to, I believe you have your nursing diagnosis textbook. Look through it. Just flip through it and look at some of it because it's really cool because it'll give you some really good ideas of what a nursing diagnosis is, and it will tell you interventions. And actually will give you all this information. It will give you examples. It'll give you what you would need to do to plan and what kind of interventions and your evaluation. So, if you haven't kind of thumb through it, please do. It'll be kind of interesting. So once you have formed your nursing diagnosis, then you plan. That's when you put together, what do I want to do? Those are your steps that you work along with the patient. You set your priorities and goals, and you want to either eliminate or diminish the identified problems. Sometimes you can't make the problems go away. There's some situations, some illnesses, they're not going to go away. But what you can do is focus on maybe diminishing. If they have chronic pain, well, you're probably not going to be able to make the patient pain-free. But if you can lower the pain to potentially make the pain more tolerable, well, that's a good good plan and it's a good goal. This is where you set your goals. This is where you state what you want your outcome to be. Now remember, when you set a goal, you have to make sure that it is measurable, that that you're able to do it, that it's not something just far-reaching that you're not going to ever be able to do, and you set a time limit. So you have to always have a time limit of what you want that done. Okay, so the patient, you want them to be reduce their pain level from 8 out of 10 to 4 out of 10 within the next 10 days. Okay, you're not getting rid of the pain, but you are reducing it, and you've put a time limit on it. So you plan, and part of this planning is how are you going to do this? You can't just wish, you got to put something together to help them manage their pain. It could be things like the time of day that they take pain medication. It could be perhaps if often with pain, it could be repositioning, being in a different position, having pillows, putting maybe a heating pad or maybe an ice pack on the source of pain. So these are interventions. And then, of course, so then you actually do it. You plan it, and then you do it. And then, of course, then you evaluate. Did it work? Let's see. Did it actually work? Here's a nice little figure here. It's a diagram, pretty much. It goes. See, it goes in a nice little circle here. Shows everything I just went through. Data collection, and it just kind of spins around in a circle. Sometimes it goes backwards because sometimes when you evaluate, you didn't meet your goal. So you have to kind of reassess. Oops, okay, we didn't quite do it. We didn't quite meet that goal. Let's reset our goal. Let's take a few steps backwards. Let's figure out a new plan, and then start moving forward again. Assessment, again, that's all the stuff that I just already said. And nursing diagnosis. See, I was jumping way ahead, wasn't I? That's problems identified, nursing diagnosis prioritized, and entered into the nursing plan of care. Here's your planning. That's the steps, what you set to set your priorities and goals. The nurse and patient do collaborate to choose specific interventions to help them meet their outcomes. Your patient, you collaborate with your patient. I mean, it's not you make all these decisions for them. You work together. And then, of course, implementation, carrying out the interventions. Some interventions may be delegated. They may be things, okay, repositioning. Well, you can delegate that to your CNA. They may be able to reposition and turn the patient every 2 hours. Evaluation. Let's see if there's anything here. Yeah, so that last one says, based on the results, it may need to be changed. Plan of care may need to be changed. That's fine. That's fine. Sometimes we have to kind of take a couple steps back and rethink things. There's no problem with that. This next section talks about critical thinking. Talks about critical thinking, clinical reasoning, and clinical judgment. And see what's on this here. So critical thinking, we talked about this in class. I basically said that critical thinking is thinking about your thinking, which a lot of you laughed at, and it does sound silly. I'm going to think about my thinking. Well, okay, it sounds funny, but really and truly, it's what you're doing. You're thinking about, all right, why I'm, and this could be with anything. I'm making a decision to do this. Okay, well, why am I making this decision? Why am I thinking this way? Am I looking at every option? Are there some other possible solutions that maybe I'm not seeing? Do I need to do a little bit of research? Let me see if what option I come up with, is it really the best? In nursing, we use evidence-based practice. Evidence-based, that means we rely a lot on scientific journals. And those involve usually research studies where they have, a group has done studies on the best way to handle certain situations. You can find a research study on just about anything you can come up with. And you will find evidence-based practice. You will find the best solution. So part of critical thinking is, hey, maybe I don't know all the options. Let me dig around a little bit. Let me see if I'm missing something. Let me see if there's something there that I'm not aware of. Critical thinking, when it's in healthcare, it's called clinical reasoning. So really and truly, critical thinking and clinical reasoning are the same thing. It's just critical thinking is everywhere. It's just in the world today. I mean, with anything that you make a decision on or anything you look at. But when you pull it into healthcare, it's more of a clinical reasoning, because that's where you're reasoning and you're thinking clinically. And you want to have this clinical reasoning result in good clinical judgment. So again, that critical thinking, it's directed, it's purposeful. You create, evaluate ideas, you analyze data, you anticipate any problems, you think about possible consequences. Okay, if I do A, what will happen next? Oh, C might have happened. Okay, but if I do B, D might happen. You see what I'm saying? You look further down the line to anticipate what the consequences could be of your action. So again, and then that judgment is the outcome of the clinical reasoning. It's the conclusion. It's basically the decision that you arrive at when you use those clinical reasoning skills. Steps of this: defining the problem, look at all your possible solutions and alternatives, consider the outcomes for each alternative, predict the likelihood of it happening, because maybe those outcomes may not happen, or they may be more likely to happen. And then basically that's when you make your decision, after you have thoroughly examined all options. So with critical thinking, there are certain skills that you need to be effective at. Effective reading. And that way it helps you know how to pick out like main ideas and relevant data. This is again like when you go and read, you can look at research articles where you're able to, you don't read the whole thing. I mean, it would be very boring if you read the whole thing, but you are going to be able to read effectively, pick out the important information. This is even how I told y'all that you should be reading your textbooks, right? Effectively reading your chapter, which means skimming, looking for main ideas, looking for anything that's in a different color font, looking at any diagrams or boxes or figures. Another way, effective reading, this is really important, is if you read a paragraph and then you can look away from it and still pretty much so recite what it just said to you, you know that you comprehended it. How many of y'all start reading something and you read and you read and you read, and all of a sudden you realize you're not even thinking about your reading, but you're thinking about, what you're going to have for dinner tonight. That's not effective reading. Read and then make sure that you can just like look away from it and be able to recall what you just read, or at least the main point. That's effective. Effective writing is also writing, being able to write coherently, clearly, logically. It takes practice. It takes practice. And it's really good idea to practice writing and having somebody else read it. Write down something even like a nursing note, and you can write down what's going on with the patient. You can write it all down, hand it to someone else and say, read this. Does this make sense? Because sometimes it makes sense to you because you know what you're trying to say, but maybe you're not putting everything into words properly, and when someone else is reading it, it makes no sense. So usually if you have something like that, have somebody else read it and say, does this make sense? Do you know you understand what I'm trying to say? Active listening. We talked about communication, and we talk about the different types of communication, and verbal and nonverbal and body language and writing and almost almost every time I ask classes to tell me about communication, I don't know if I've ever had anyone say listening. And listening is a very important part of communication. You know, as they say, we have two ears and one mouth. We should be listening twice as often as we're speaking. And that is when active listening is when you are focused on the topic of discussion. It's very hard to do. It takes practice. Try it. When you're talking to a friend and they're telling you about something and then you start feeling yourself drifting out and dozing, basically thinking of something else while their lips are still moving, you're not effectively listening. Pull yourself back in, rein yourself back in, and get yourself back engaged. It's kind of hard to do. It really is, and it does take practice. And the more you do it, the better you are. Now, please, when you are with a patient, please listen to what they say. They will sometimes say one little word that can change everything. I've had this happen so many times in nursing, so many times where I picked up on a word that I went, wait, what did you say? And it completely made a huge difference. Real quick story. On a neuro floor, woman that was having double vision, she had every test under the, that they could think of. I mean, they were thinking stroke and just causing this double vision. They did everything to this woman, could not find a cause of her double vision. And over the time, she was there in the hospital for about 4 or 5 days. By the time she was about to be discharged, it had resolved. It had cleared up. She was fine, but no one really knew why she had it. Don't really know. Oh, maybe it was a TIA, which is a transient ischemic injury, which is, it's kind of like what they call a mini stroke. So they were kind of saying, well, maybe it was that, but they really didn't know. I'm getting her discharge paperwork so she can go home, going through her meds. She starts talking about one of the medications she takes, and she went, oh, I just got so messed up. I'm only supposed to take one a day, and I really got messed up with my thing. I realized I was taking 2 a day. I did that for a whole week. I just got messed up. I just didn't realize I did it. And it made me stop and think, and I thought, she took this medication. She was supposed to take it 1 time a day. She took it 2 times a day by mistake for several days. So I was just kind of like, okay, I'll be right back. And I went out and I went and looked up that medication because I wasn't familiar with it, looked up side effects, and guess what? One of the side effects was, if you said double vision, you win. I'm going to say a cookie, but I don't have any cookies. So, but you win. Absolutely. This woman had overdosed on a certain medication, caused blurred vision, came to the hospital. They worked her up for stroke, checked everything. I mean, we're talking about images of her brain. They brought in an ophthalmologist, look at her eyes. No one knew what went on. And just because I'm sitting here listening to her ramble on about, oh, my medicine, I just got all confused. And I went, oh my gosh. And I immediately texted the doctor and I went, oh, you're not going to believe this. And then when I told him, he was like, you have got to be kidding me. Guess what, guys? This was just listening. And she probably even said this in the emergency room when she was admitted. And if anybody had opened their ears and listened to her, she wouldn't have had to have all those tests done. She could have just gone home. So please listen. Listen to people. All right, last one's effective communicating, which crazy because active, attentive listening is part of that communication, right? It's funny because your textbook talks about it with speaking. And again, like I said, communication is listening as well. But speaking in a disciplined manner, you think about what to say and how to say it clearly and concisely in a logical way before speaking. So often we just tend to say the first thing that comes to our mind. And we say things that we shouldn't say. And then afterwards go, oh man, I shouldn't have said that. Or maybe you don't do that. But slow down. Think about what you're going to say. Speak concise. Always think before you speak. And and this isn't just with patients, but do this with everyone. Do it with your classmates. I hear an awful lot of maybe some speaking before it was thought out. And I think it would make the world much better if we all thought a little bit carefully about what we were saying. All right. There we go. So critical thinking, it does require skill and experience and knowledge. So right now y'all are at the very beginning of your nursing journey. So we understand that your critical thinking is it's still being developed. It's still being developed because you are just learning. You're just gaining this experience. But we're going to give you the tools to be able to critically think. Influenced by professional standards and codes of ethics. Well, absolutely everything we do as a nurse, we follow our professional standards and our code of ethics. Here it goes again through the critical thinking along with the nursing process. I don't think there's anything really new here, other than as you gather information, you should be thinking and having your brain kind of thinking about what's going on as you're doing your assessment. So just some pointers. Critical thinking, that's basically pretty much so everywhere, inside or outside a clinical setting, but within the healthcare environment, it is called clinical reasoning, and that is making the observations on the health status and coming up with conclusions based on the data obtained. And then clinical judgment is the outcome. It's the conclusion. It's your goal. So here's a question. All right. Which of the following is an example of a nurse's statement that reflects using the scientific method in the nursing process? So let's read this again. We always should read these questions very carefully. Nursing questions are sometimes tricky. Which of the following is an example of a nurse's statement that reflects using the scientific method in the nursing process? And the scientific method, of course, remember, if you remember back, that's like a hypothesis. That's an educated guess, right? So scientific method. I believe that this patient is getting depressed. The patient doesn't look right to me. I think something's wrong. The patient's husband told me she's feeling very uncomfortable. Or the patient reports more pain than yesterday and her blood pressure is elevated. What do y'all think? Well, I would say that the first three are basically, they are statements, but they're, look, I believe the patient's getting depressed. There's nothing scientific or any kind of like any kind of proof. It's almost like I believe. And then it's like, well, the patient doesn't look right to me. That's the next one. I think something is wrong. That doesn't sound very that sounds almost more like intuition. And then, oh, the patient's husband told me she's feeling uncomfortable. Well, that's coming secondhand. That's coming from the husband. But look at the last one. Patient reports more pain than yesterday, and her blood pressure is elevated. Okay, we got this straight from the patient. It wasn't a I believe or I think or her husband told me. This is coming straight from the patient. She reports that her pain is higher today than it was yesterday, and her blood pressure is elevated. There's your critical thinking. There's taking it one step further. When someone is in pain, their blood pressure rises, their pulse rises, their respirations increase because, when you're in pain, you're going to be breathing harder. Your body is going to reflect that. And so here, this was not only did she get the information straight from the patient, but she also sees. This is basically an example of subjective and objective, right? Patient told her, I'm in pain. That's subjective. And now she sees that this patient's blood pressure is rising. That's objective. So that is the correct answer. All right, priority setting. Okay, we have to set priorities. As nurses, we are given a lot of work, and everything's important. Every patient's important. They're all given medication to be given roughly at the same time. Well, that can be a little overwhelming. So how do we deal with that? We set priorities, right? And a priority is when you look at, you have a problem, a priority is more important than something else at the time. So you have to prioritize your tasks. You have to prioritize what you're doing. It involves putting um, like even problem statements or nursing diagnosis or nursing interventions in order of importance. So when you do your plan of care, you need to do it in order of importance. The highest priority comes first, because sometimes you can't get to the lower priority things. All you can do are the high priority. So the high priority things are first. So when you're putting those plan of cares together, and care plans, remember that they are those problems, those diagnoses are put in order of priority. We use Maslow's as to help us with priority. I think we looked at Maslow in class. I'm pretty sure we did. That was, yeah, I know we did. The pyramid where you have the very bottom of the pyramid is the most important thing. That's your air and food and water, being able to breathe. Those are a higher priority than feeling loved, which was up closer to the top. Feeling loved is still important, but having air to breathe is more important. So, high priority, that could be life-threatening. Well, not could be, is. It's a little more of a life-threatening problem. Medium priority is things that could threaten your health or the coping ability. And low priority, the things that do not have a major effect. If it can wait till tomorrow to be done, then that's fine. It's not going to be a big deal. But high priority has to be done right now. High priority would be someone's oxygen saturation is 85. Um, Low priority could be, um, oh, what's a low priority? I can't think of one right now. Patient needs a bath. They haven't been bathed in a couple of days. Okay, well they need to be bathed. It's going to make them feel better. They're going to smell better, but that can wait till tomorrow. If their oxygen level's 85, they may not be here tomorrow to get a bath. So obviously we would prioritize the oxygen over the bath. Priorities change as the patient's conditions change. Absolutely. These change all the time. Patients change, their conditions change. You can have a patient that's very stable one moment and then just flip. And next thing you know, you're doing chest compressions. So that's why we have to watch our patients very carefully, because they do change. And how do we keep track of this? And we talked about this, and I know that some of y'all had problems hearing me, and but we have a lot to do. We have a lot of patients, and each patient has a lot of, they may need dressing changes, and they need their medication, and they need vital signs, and they may need, oh, who knows, they may have a G-tube and may need a G-tube feeding. They may have a catheter, a urinary catheter, and may need the catheter, assessed and cleaned, or the bag emptied. So you've got all of these tasks. So how do you know what to do? What to do first? We rely on, typically we call it our brain. It's a brain sheet. It's a piece of paper that we can have, and I say a piece of paper, that's because I'm old school. Some of the computer systems at the hospital, like Baptist, well, a lot of the hospitals I think here in town, Baptist and UF, both use Epic. And Epic actually has the brain as the first screen that comes up, so it organizes it for you. But it's basically it's a sheet that gives us a way to prioritize our tasks. People that are on vancomycin's IV antibiotic. Well, there is oral vanco, but anyway, vancomycin has a very narrow therapeutic window, meaning the dose has to be just right for it to work. Otherwise, if it's not quite enough, it's not going to do any good, or if it's too much, people can get a toxicity or overdose. So it has a very narrow therapeutic window. Well, when you give patients in a healthcare facility vancomycin, we have to draw labs every so often, and it's called a vancotroph, which is to test to make sure that checks their blood to make sure that the dose of medication they're getting is right. Well, the thing is, you've got a vancomycin, you're supposed to give them vancomycin at 9 a.m. and then it's telling you, oh, but you have to get that blood work done beforehand, you better have that written down because time gets away with you really fast in a healthcare facility. You look up and 3 hours have gone by. So that's why you have this sheet or something to keep you on task that says, okay, at 8 a.m., I have to go in and draw this blood on this patient and send it to the lab so that I can make sure that the medication I give at 9 is the right dose. So you have to keep track of that. I used to have all different color. I had one of those pens that has little clicky things at the top, different color ink, red, blue, black. And I would write and I would prioritize my day with my pen, and the things that were my high priority would go in red. So those were things that I knew I had to do at a specific time, and it just helped keep me on task. One of the things here, know when to ask for help. There's times when I was in the middle. I mean, good gosh, you could have a patient that's completely tanking, and they're, you may have to call like a rapid response on them or something, and oh, but now Mr. Jones down the hall needs his blood drawn at 8 a.m. for his Venco. Well, you've got this other Mr. Smith over here who's trying to die on you. You can't leave Mr. Smith to go draw Mr. Jones's blood. So that's when you rely on either your charge nurse or even, it's a really good team, usually a really good team in a healthcare facility where you've got your buddies and go, hey, can you, I'm in the middle of this. Can you go draw that, blood for me? So do rely on your team. Do know how to delegate. Do ask for help. Don't try to be a Superman and try to do it all because one, you're not going to be able to, and two, that's the recipe for burnout. Here's an example. Assignment work organization sheet goes through, talks about the patients, different things that need to be done. See, mine could look like that, but then I would even use my little red ink, and I would either write certain things in red or I would even underline them or circle them in red, things that had to be done. Let's see. We've got vital signs, quick assessment. The number second one down, GH, he's got a feeding pump 7:30 a.m. So we've got vital signs, a quick assessment on the first patient, vital signs and feeding pump on the next patient, and vital signs, IV, and quick assessment. So what would you prioritize? What would be the highest priority? Which patient should you see first right there? 7:30, you got 3 patients, you got all these things to do at 7:30. You can't be in 3 places at once. Who are you going to go see first? Hopefully you said the feeding pump. I would go take care of the feeding pump because vital signs, you can do vital signs anytime. The assessment, whatever. But the feeding pump you need to get that feeding pump going. Next thing I would be checking that IV. So those are the 2 important ones. And then, of course, everything's important, but those are the 2 highest priority. Let's see, 8 o'clock shower. Looks like a dressing change. Okay, so he'll probably have a shower and then a dressing change, an assessment, and then the last guy or person gets medication and check his IV. So, all right, well, if they're going to get a shower at 8 a.m., and then they need a dressing change, it's going to take them a little bit of time to get the shower. Your CNA is probably going to be giving them a shower. So that gives you a little bit of wiggle room there. So you can go run down to the 528B patient, check that IV, give him his meds, poke your head in to see if the first guy is still in the shower. If he is, awesome. Run back down to the GH 528A, do your quick assessment, and then run back, and then he should be out of the shower. You can change his dressing. See what I say? You got to look at these things, what you got to do, and figure it out. 9 o'clock, 9 o'clock gets tough. Look here, we got meds for the first guy, we got meds for the second guy, and we got meds. No, we don't have meds for the last one. We have assessment and a chart. So obviously the meds come first, other than the assessment. So, okay. We talk about cluster care. I'm kind of jumping and giving you terms, but you'll need to know this. Cluster care. So if you typically have an hour for like medication you can give, if it's due at 9, you can give it up to an hour early or an hour late. So that means I could give that 9 o'clock med at 8 a.m. So when I go in there to change his dressing after his shower, I'm going to take his meds with me, and I'm going to go ahead and give it. So I'll change his dressing, give him meds at the same time. That's clustering your care. You put it together in a cluster instead of going in and out and in and out. Grab up all your stuff, try to do it all at one time, and try to time it just right. Can I do it at the same time? Let me see. Well, dressing changes at 8, meds at 9. Heck yeah, because I can start giving my meds at 8, so I'll just do them both at the same time. And done. So this is how we prioritize. We go through it, and this is very accurate for what your day is going to be like as a nurse. Very accurate, except you're going to have way more than 3 patients. Here's another example of a sheet. The last one had it all kind of lined up. This one has it like patient, like the top third is everything about one patient. The middle one is another patient, and then the last one. This looks a little bit more familiar with what, like, kind of something I had, but everyone has kind of a different version because it's what you're comfortable with working with. And see, here's yet another one. So there's many different options. Just for the heck of it, Google nurse's brain sheet. Just Google it, look for images. You will see many choices. All right. So again, your goal is to avoid injury. We do not want to do any harm, right? Do no harm. So avoid injury. That is it. With critical thinking skills, you look at your different factors. You make your solve problems, make decisions, and in a critical thinking mode that helps you develop your clinical judgment. Okay, this is actually last slide of here. So which of the following nursing actions is the best example of problem solving? So this is nursing action that is a best example of problem solving. Requesting the IV team to start an antibiotic drip on a patient with a history of being a difficult stick. Okay. If they're a difficult stick, you may want to ask the IV team, okay? Or offering to call the kitchen to provide an alternate breakfast for a patient who does not like cooked cereal, all right? Or trying several difficult wound dressings to determine which one the patient can apply the most effectively. And then the last one says calling for another pain medication order when the current drug results in the patient experiencing nausea. So here's the thing. Which one of these actually requires critical thinking? So the first one, you got a difficult stick, you call the IV team to come put in an IV. That's not critical thinking. That's just a, hey, this is a difficult stick, I need you to come do it. There's no thinking involved in that, right? I mean, very little thinking. Offering to call the kitchen to get an alternate breakfast because they don't like what they're getting for breakfast. Is that critical thinking? That's just kind of like, hey, I don't like my breakfast. Okay, I'll call. There's no critical thinking. And then number 4 as well. Person's getting nausea. That's just, I mean, that's almost just like common sense. This medication's making you sick. Let's get you a different one. Now the third one, number 3, you're going to try several difficult dressings to determine which one the patient can apply the most effectively. So this one is, you're thinking long term because you're not just going, okay, let me put on this difficult wound dressing. You now have to think, this patient's going to have to change his own dressing. This type of dressing is going to be too difficult for him to do on his own. I need to find one that he could do himself. This is critical thinking because now you've got to try different options, and you're thinking long term because you're not just thinking in the now. You're thinking, how is he going to be able to do this? So that involves critical thinking. Alrighty, I am done with this chapter 4. So if you have any questions, please reach out to me. Thank you.